So anything that you hear today from the speakers, please share it with all. Talk about it at the dinner table. Talk about it in the lunchroom. It's all there for you to be talking about. So our fall conversations with leaders were great. Terrific discussions and really interesting and good learning from each other. And it's a good thing because working in the seniors care sector today, it's not so easy. There's the ongoing challenges, of course, of increasing resident acuity. There's labor shortages, there's funding issues, and of course, that's all kind of with the malaise of kind of the COVID hangover. So people can feel tired, they can feel grumpy, they can feel overwhelmed, and it can lead to all sorts of problems, including safety challenges for the people you care for your residents, and also for your staff. Yet some leaders, some organizations, they have the same challenges as everybody else. And yet how they navigate those issues, it can be pretty inspiring. They are somehow gracious, they are wise, they are able to bring the better out of people. How do they do that? Well, a lot of it, it's social intelligence. So that's where we have been in our series. So here's where we've gone. We introduced the idea of social intelligence in our first call, and then we looked at when there is a deficit of social intelligence that shows up with incivility, and then also what's possible when there is an abundance of social intelligence. That's when there is psychological safety. So today, well, it's a safety surprise. What is that? So the Conversation with Leaders series, it's about giving leaders actionable strategies to improve team communication, improve respect, and overall workplace well-being. So that's what the series is about generally. This year, we've used the lens of social intelligence to give you that. And SafeCare has managed somehow to get some funding for some terrific actionable strategies for members. And we do have guest speakers to tell you about them today. Yay. So it's all very exciting, and recognize that you have a lot on the go. So oftentimes when people come to meetings like this, especially Zoom, your minds are, or your body's here, but your mind's not so much. You have 50 billion, tabs open, you have phones ringing, devices going. So I have a request. Please close all of your other tabs, close your email. I know. Do it anyway. Put down your phone, turn it on mute if you can, just so you can be fully present. And we are going to experiment with an activity to more fully arrive, so that your body and mind are in the same place at the same time. And it's a little different than what we've done before, yes. Today, we're going to be doing something called a psychological sigh. I'll send you a link later so you can get the little video on it. If you can sit yourself in a posture that has you feel both relaxed and alert, and we're going to take some breaths. Here's how it goes. You're going to take 2 short inhales through your nose. You're going to hold for a moment or 3, and then you're going to do a long exhale through your mouth. Let's do that again. Hold. One more time. See, there you go. Feel less stress, feel more calm. That's great. And this is something that you can do whenever. You can do it when you're walking down the hall. You can do it when you're going to be going into a not so easy conversation. My family knows when I'm feeling a little grumpy because I'm doing it often. And I think, aside from their complaints, they appreciate it because I am probably a little kinder after I do it. So taking this kind of pause is exactly what social intelligence is about. So let's get started. So we have many folks registered for today, and recognize that some of you have not attended the previous calls, which is completely fine. And if you did, it's been 3 months since we last met. It was last year. So we're going to do a quick flyby of the essentials, the principles, the foundations of what social intelligence is. So you've probably heard of emotional intelligence. You can think of social intelligence as a subset of that. It's our social radar that helps us get stuff done in a social setting. There's a great definition from Dan Goleman. He wrote a book called Social Intelligence. He says it's about being intelligent, not just about our relationships, but also in them. So it's acting wisely in human relationships. And this fits with researchers' findings that this social radar, it comes from 2 things. So there's the cognitive, the thinking part, the awareness, or social awareness. It's our social literacy, our ability to read situations, our ability to understand our own and others' feelings, thoughts, behaviors in interpersonal situations. And then there's another part. There's the behavioral part. It's the effective social action. It's the ability to act appropriately on that understanding that you have from the cognitive piece. It's the ability to promote and build meaningful relationships in our work and in our lives. So to be clear, social intelligence, it's more than empathy, because empathy doesn't necessarily require a deep understanding of the broader social context or managing relationships effectively. There's one other piece. So with kind of innovations and stuff like with MRIs, neuroscientists know more about what social intelligence is about. Turns out that we are actually wired to connect, literally. We have these mirror neurons so that have us mirror what's happening in terms of emotions that we're picking up from others. So we catch strong emotions. Emotions are contagious. Our brains kind of couple through this feedback loop. We kind of form this interbrain circuit, if you will, like a neural bridge. And that neural bridge, that connection, it can be pretty powerful. So the more that we're in sync, the more rapport that we have with others, the more positively we feel about the encounter and about each other. There's also other things that happen. It makes it possible for us to be creative together, to be productive together, to be more efficient in making decisions. So that's what we know from the science. All very interesting. I'm more curious about what you think of it, actually. So I know I said close all your tabs, but now I'm changing my mind. So if you can open a new tab, or you can go on your phone, whatever. If you can go to www.menti.com. Got it? And it's going to ask you to open or to ask you a code. So if you can enter in this code 82294361. And you need to answer a question. So would love to hear from you. So what do you think? Do you think social intelligence is relevant in seniors care? Like, does it help? Does it matter if staff, if leaders have social intelligence? Does it make a difference? So, I mean, I have an opinion, scientists do, but really, we want to hear from you. It's okay if you don't. It's okay. It's fine. We may convince you otherwise, but it's just super helpful to know. All right. So folks have responded, and it seems like they do. They think it's important. Okay, good. Good. I think so too, but again, it's just helpful to know. All right. So some folks, most folks, everybody here who's answering the polls seems to think it's important. Excellent. Next question, if you're ready for it. So do you think your staff having social intelligence, can it make a difference in terms of safety? Can it help your staff be safer? Can it help your residents be safer? What do you think? Again, you have two choices, yes or no. Somebody thinks it's a great question. Excellent. Well, that's fantastic. I think it is too. So intriguing. So one person says no, and that's completely fine. Completely fine. You may be convinced otherwise, and I so appreciate somebody, right, the safety. Good. So most think that having your staff having social intelligence can have or help people be safer. So for those of you who think it can, would love to know, how does it do it? How does social intelligence make your staff or your residents safer? Like, what is it? And this is a text field, so you can enter in up to 200 characters. You can actually put in multiple answers. So what is it about social intelligence that has your staff or your residents be safer? Like, how does it do it? Like, what do you think? And again, you can put in multiple answers. You can put in text up to 200 characters. So what is it about social intelligence? It contributes to a civil workplace in which staff are respectful and kind to one another. Yes, yes, it does. It's true. More positive exchanges of emotions equals better connections and better interactions. Yes, right? That whole thing, that mirror neuron thing. It helps to communicate more effectively. Yes, people are going to be hearing it more. Kindness, it prevents our emotions to elevate and create conflicts. It enhances the ability to understand and endure. Yes, and interpret both verbal and nonverbal cues. Yes, so this can be really helpful, especially with residents. Well, with colleagues as well, but if you have residents, especially those that may not be verbal. Understanding can lead to trust and more openness, builds confidence, more observant of resident needs. It may help you predict hazards more easily. Yes, like that risk assessment, higher awareness of the situation. Trust creates empathy. Psychologically safe shows our ability to care for others, navigate social situations, be aware of our own social abilities, and communicating shows compassion. Recognize others' triggers, recognize your own triggers, yeah, so that you may not act on those triggers. Help understand the difficulties, better emotional support. Yes, yes, yes. So for the person who wasn't so convinced, hopefully this information will have you think, well, maybe there is a connection. Because here's the thing, there's actually a significant amount of research that shows that there's a connection between social intelligence and quality of care. There's also a connection between social intelligence and well-being and better communication and all of those good things. All right. So very intriguing. What happens when there is a deficit of social intelligence? It can lead to incivility. So we talked about this in our October conversations with leaders. So we are lucky today to have Heather Cook along to give us some insight and resources. So Dr. Heather Cook, she is the Manager, Research and Knowledge Mobilization Manager of that at the Alzheimer's Society of BC. She's also an adjunct professor at UBC School of Nursing and SFU's Department of Gerontology. Heather's worked in the dementia care field for almost 30 years, and she's passionate about improving the lives of individuals living with dementia and also the lives of their caregivers, whether those caregivers are in the community or in long-term care settings. So we're going to be hearing from Heather in a moment, but to get us started, want to just check in with you folks one more time. So we're going to go back to Mentimeter. I'm going to ask you another question. Does incivility happen in your building, or does it happen in your work group? Yes or no? You know, go to Menti again, same code, yes or no answer. Does it happen? Is it a thing? Do you see it? Okay. Okay. And you can be no, it's okay if it doesn't happen. Again, we're just looking for information. All right, so 16 out of 16 say it does. Okay, so let's hear more. How does it show up? What are the behaviors of incivility? And again, you can put in text here up to 200 characters. And you can put in multiple answers if you'd like. Let's see. Gossiping, yes. Passive aggressiveness, gossip. Oh, gossip's a big one. If we'd done a word cloud, that would have been a big one. Okay. Any other ways that it's showing up in terms of behaviors? Bullying, yelling. Heather, I hope you're getting ready. Kajal, is Heather unmuted? Okay, good. Disrespect, gossip, backstabbing. Disrespectful, conversation, anger, resentment, not considering how your actions impact others. Okay. Ignoring. Oh, that's a good one. Yep. Bossing. Yeah, bossing people around. Absence from work. Disrespectful behaviors, labeling, discriminating, different language to each other while providing care to residents, the resident that may not speak that language, tattling, criticism, slamming things like passive aggressive, ignoring, not sharing information, lower emotional intelligence, segregation, so kind of excluding folks. Yes, yes. Heather, is that good enough?
Sure is.
Okay.
Sure is.
All right.
Okay.
So what do you say? What can folks do about this?
So not surprised at all to see this come up. So we started this research, gosh, about 7 or 8 years ago now. Work that had kind of bubbled up in the research that I had been doing in long-term care and having worked in long-term care on the front lines as well. And obviously that continues and we see this happen on a fairly regular basis. And so I think where I want to start is I noticed that someone had put, how does incivility show up? And someone had typed in bullying. So I think it's important if we think about incivility and bullying as being on a continuum. So you can think about at one end, you've got civility. At the other end, you've got bullying and harassment, or B&H as we might like to call it. And then in the middle, we have incivility. And you know, by that, we're talking about low intensity behaviors. So they typically violate those workplace norms for respectful interactions with your colleagues. And there can be this ambiguous intent to harm. So it's never really clear what's actually meant behind that behavior.
Mhm.
And that's a little different than bullying, where there's a very obvious or that intent to harm. The behaviors are that much more egregious. So really, we're talking about the microaggressions. And the passive aggressiveness. I think someone had typed that in here to the response to the Menti poll. What we often see with incivility is that it's passive, that it's indirect, and it's
Mm.
often verbal.
Mm.
What we see with bullying, in contrast, is that it's often active, it's direct, and it's physical. And so what we start to see here is a bit of a gender divide in terms of incivility and bullying. So when we're talking about long-term care, we're talking about workplaces, as all of you know, that are highly gendered. The majority of those frontline staff are women. And women tend towards this more relational aggression or this incivility. So they tend to use those passive aggressive microaggressions. It shows up in many of the behaviors that you have highlighted here on the screen: the gossiping, the tattling, the ignoring, the exclusion, the thank you for moving the screen there, Mary Ellen. That's great. The backstabbing, the disrespect, and in many ways that's, women not being overt in their aggression, but like a man may be far more likely to just come out and yell at someone and deck them, and that then it's done and dusted. Whereas for women, it's often a lot more subtle. It percolates along under the surface. So as we were doing this research and we're hearing from folks, we're like, okay, what are we going to do with this? How are we going to help people address this issue? Because this issue really isn't going away. And so we developed this online toolkit, and we partnered with Safe Care BC, and it's the Civility Matters Toolkit. Oh, fantastic. We've got it up on the screen in front here. So and what we wanted to do is to be able to provide resources, to provide examples, to folks working in long-term care. And it's actually kind of interesting. I swim competitively, and I have a couple of teammates who work in healthcare, but not in long-term care, who have struggled with toxic workplaces. And I've actually forwarded the toolkit over to them. So I know it's had a bit of a further reach. And so what we wanted to do was develop kind of two entry points within the toolkit. So you can enter as an administrator or as a manager, and you can enter as a frontline staff. Now, you don't have to put in anything that, confirms your status as either one of those. You're free to hop back and forth between those. But we wanted to sort of tailor some of those resources towards managers and administrators and some towards frontline staff. And so within the toolkit, we start off with a bit of an explanation, like what does incivility look like? What does bullying look like? Some of those pieces that I've already talked about, how, our workplace policies typically align, those bullying and harassment policies typically align with men's behaviors, with
Mm.
that outward aggression from
Mhm.
men, not so much what we see with women's behaviors. And I'm
Mm.
using men and women intentionally here as we think about gender, because it is very gendered.
Mm.
And this can be challenging with our workplace policies, because we have policies around bullying and harassment, but again, that incivility doesn't always escalate to that level. So within the toolkit, there's a couple of webinars that we have done for Safe Care BC over the years. In fact, we did our first one immediately pre-COVID, just the beginning of March, right before the world kind of shut down. I think
Wow.
that was possibly the first. So 5 or 6 years ago now, 5 years ago.
5 years ago.
Yeah. And then we wanted the tool to be practical. We wanted to give people, like, how do we develop skills in this area, develop our, build up our toolkit.
Mhm.
And so one of the things we have within the toolkit are practice scenarios. Originally, I think we started with 11. We've added another 6. And then we have, I think, another 10 waiting in the wings. I know Safe Care is looking at doing a refresh of the site later this year. And so those new scenarios will work their way in as well. And so these can be used individually, kind of you can work your way through and think and reflect, like what would I do in this situation? How might I handle this? There's, sort of a more appropriate way to respond and perhaps a less appropriate. And both of those options are there in the answers and kind of explain why one might be more suitable for a response than another. And we've tried to kind of balance them. Some are for frontline staff, some are for managers, to kind of reflect the diversity of staff who may be using the toolkit. And they could also be used in a training session. So if you've got new staff who are, being onboarded, it's like, hey, let's talk about what our workplace looks like, how we're going to bring our best selves to work, how we're going to interact in a kind and respectful way with our colleagues. And so there's opportunities for that as well. It's a great training tool in a sort of small group discussion. And those scenarios are based on the examples that we've heard over the years. So not just in the research, but then in the conversations, that I have with long-term care administrators. And we've continued to go back to sort of say, what are some of the things that you're hearing in the care homes, and then building the scenarios around that. So we really want them to be situated in the actual experiences of folks. And then the other key piece to the toolkit is the resource section. And this is a curated selection of resources that are both print. They're also web-based resources, so things like TED Talks and videos and books. We tried to indicate kind of how long, like watching this clip it's a 5-minute view or a 10-minute read, so that people can dive in and out depending on the time that they have available. And sort of tried to set that up in that way. And again, resources tailored to administrators, resources tailored to frontline staff. You can have a look, go back and forth between the two. And then we also included some kindness card templates. And these you can either order through Vistaprint. There's a direct link to sort of help you order and have them professionally done. But you can also download them and pick up the templates from Staples and print them yourselves. And there's 3 cards on there. And the idea is just to kind of orient staff to that this is a workplace in which we are kind and we are respectful and supportive of one another. So for example, one of the cards on the front says, couldn't help but notice, and then you spin it around and it says all the great things that you bring to the team. And I'm going like this because they're sort of business side cards. So you can kind of print them off and spread them around the workplace, if you will. One of the others says, kindness is contagious. And you flip it over, and on the back it says, tag you're it. So we worked with a graphic designer. So some of the graphics, like the ones you see here on Mary Ellen's screen, kind of form the basis for those. So really, again, designed to distribute to staff to really just help shift how we think about social intelligence. So it was so great to have that explanation, Mary Ellen. And I'm really thinking of how incivility really just falls so nicely within that. So I do encourage folks to reach out, check out the site, play around with it, dive in, watch a video, watch a TED Talk, and I'm hoping that you can find resources in there that will help you create those healthy, respectful workplaces that we're all looking for.
That's fantastic. Thank you so much for that. So I'm just checking. So here, I have a next piece. So if you have any questions for Heather, please just pop them into the chat. And that's fine if you don't have any questions. So here is the request to one and all, whether you have questions or not. Listening to people like experts like Heather talk about things. Oh, it's so exciting and it's so super helpful. Great. And that's great information that doesn't actually get used. So I have a request. Whatever device you use, whether it's a piece of paper and a pen, I know old school, or maybe it's your phone, like whatever's going to work for you, just note down for yourself one idea that you may want to experiment with from what Heather had said. You're not committing to anything because we're going to do this at the end of each section, but just note down something that occurs to you. Maybe it's going to be having people practice scenarios. I don't know. Or maybe it's going to be having staff get together to watch a video, or you just going on the Civility Matters toolkit, or handing out the, I don't care. Just pick one thing, or maybe you were listening to that and, oh, and some other idea came to you. Whatever. Just note down for yourself. I'll give you 30 seconds. One idea you may want to experiment with from the toolkit or from what Heather had said. 30 seconds. And there's an idea here. The kindness cards can be super cute, right? She didn't say that, Shelley didn't say, but talking about it during orientation, adding it to your orientation process, nice idea. Very sweet. Absolutely. Okay, I think that's 30 seconds. Good. So if incivility happens when there is an absence of social intelligence, psychological safety or psychological health and safety is a result when you have plenty of social intelligence. So we talked about psychological safety in our November conversations with leaders. And we are lucky today to have Sheila Foman along. She is SafeCare's workplace psychological health and safety coach. She has a wide range of expertise and experience in mental health and wellness in the healthcare and the justice sectors. So she's going to give us some insights and some resources on how SafeCare BC can directly support you, SafeCare BC's member organizations. Before we do that, though, want to hear from you. So if you can, go to menti.com yet again. Yeah, see, we didn't have the breakout groups, but we're wanting to have this be interactive because you're so interesting. You know things. So we have another question. This one's on a spectrum. So a scale of 1 to 5, where 1 is it's an unknown abstract concept and 5 is, oh, I totally get it. The question is, how comfortable are you with the concept of psychological health and safety? So 3 is, yeah, I want to learn more. 1 is, no, abstract, unknown, don't really get it. 5 is totally get it. Let's just see where you're at. Good. So this is really helpful for us to know. It's going to help Sheila in terms of, and Sheila, if you can get yourself ready to talk, that would be great. It's going to help Sheila in terms of kind of cluing in what needs to be talked about and where people are at. And it's also just super useful and interesting information. All right, so that's that one. Excellent. I think we have enough. Let's go to the next one. So we have heard about incivility happenings. We're going to zoom out a little bit broader to understand what's happening in your workplace. So for this poll, we're curious if any of these are concerns in your workplace. So there's 7 items. You can pick as many as are relevant for your workplace. Is employee turnover a challenge or an issue? Patient care, quality of care? Or how about profitability? Financial metrics. So if you're a nonprofit, then it would just be the financial metrics. Bullying and harassment, is that an issue? Or incivility? Or absenteeism? Or recruitment? Which, if any of these, and you can, as I said, you can pick as many as you would are relevant for you. So let's just see, we have 9 folks. Intriguing. So profitability, the money stuff isn't coming up so much. The turnover thing isn't coming up so much. Incivility is. Quality of care is. Bullying and harassment. Absenteeism. Fascinating. Okay, let's go to the last question. Last question, here we go. Again, rating on a scale of 1 to 5, where 1 is not confident at all and 5 is super duper confident. How confident do you feel to address psychological health and safety in your workplace? And again, 3 is kind of like I'm, wanting to learn more. So let's see where folks are at. Again, it's just really helpful for us to know where people are at so that we can make sure that what we're talking about is relevant for you. So we have folks that, kind of want to learn more. That's great. We have a range. Good, good. All right. So let me just go back. So Sheila, are you there? Are you ready to talk? I'm hoping.
I'm here. I'm ready.
Okay, so good, so good. So let's go back to the first one here. So we were talking about where folks are at in terms of understanding what psychological health and safety is. So it'd be helpful to hear from you. How do you explain psychological health and safety? Like, how do you understand it?
So psychological health and safety is really about the impact that the conditions of an environment can have on a person's mental health and well-being. So when we talk about psychological health and safety in the workplace, what we're really talking about are those conditions that are associated with the workplace and the work and the impact that they have on employees' mental health and well-being.
Okay.
So you may have heard of these conditions referred to as workplace factors or job factors.
Okay.
Many of you indicated that, psych health and safety feels a bit abstract or unknown to you, which I can completely appreciate. And one of the ways that kind of have really helped me to understand psychological health and safety is sort of to peel back the onion and look at the why and how that the conditions of an environment can impact a person's mental health and well-being. And what this really relates to are kind of those basic psychological needs that we all share as human beings. So if you're familiar at all with the CSA standard on psychological health and safety, they do provide kind of a more detailed list of these basic human needs, which I kind of summarize as the following 4 things. So it's a need for our physical and psychological safety. It's a need to belong. It's a need to matter, feel valued. And it's a need for self-actualization, which is, a sense of accomplishment and fulfillment. So the way in which these needs relate to psychological health and safety is ultimately that psychological health and safety is a reflection of the extent to which the conditions make a person feel that their basic psychological needs are being met, not met, threatened, or considered. So put really simply, when you have an employee that feels safe, when they feel like they matter, when they feel like they're included, that their opinions are valued, when they have a sense and opportunity of fulfillment in their work, their psychological needs are being met. And this is going to have a positive impact on their mental health and well-being.
Right.
This reflects an environment that is psychologically healthier and safer. On the other hand, talking about incivility, for example, right? When you have a person or an employee who feels that their needs are being unmet or threatened, so incivility, they're not feeling safe, they don't feel like they're included, they don't feel like they belong, they're feeling discriminated against, this is going to have a negative impact on their psychological health and well-being.
Right.
And you have an environment that is psychologically less healthy and safe.
Got it. Okay. So, okay, let me see if so there's kind of like these 4 factors, and they're all kind of contributing to this environment. And that's kind of the gist, right?
Yeah, they're the needs we all have.
Right.
And we need those to be met.
Right. And so what I appreciate, or what I'm noticing, is kind of the connection between social intelligence and psychological safety. It feels a little bit like they're a chicken egg, so that, like the chicken egg thing, right? So that if a leader or colleagues have social intelligence, then they may be, because they're cluing into what's going on with somebody else, so they're also aware of what's happening to them, it's more likely that they're going to be creating psychological health and safety for, like, kind of creating that environment. And then with that, if I'm in that kind of environment, then it's more likely that I will have my better self show up. So I will be more emotionally intelligent. I will be more socially intelligent. So kind of when I have more of the psychological health and safety, I'm going to have more social intelligence. When I have more social intelligence, like, it kind of feeds together. I don't know which one comes first. And then same thing. If I don't have that as a leader, or my colleagues don't, then it's going to come, right? Then I'm not going to be bringing my best self, because I don't feel belong. I don't feel like all those. So it kind of feels like I'm not sure which one comes first, but they're connected. Okay. So that's thing 1. The other bit that I kind of picked up then is that the psychological health and safety is really, it's about what's the environment in the workplace. And workplaces are nuanced, right? Like, they're unique. So in specific to seniors care, for example, there are things that will be impacting, whether it's the psychological demands on an individual. I mean, for example, the people that staff are caring for, this is their last home. There's going to be people dying. So there's grief and stuff that comes up, and it's not an unusual experience. There's going to be violence that happens, and it's tricky. I mean, so first of all, I might have a resident who is having adverse or violent behaviors, so that's not great. And then there's also the thing of all the internal confusion that this person is acting this way, and it's not them, it's an illness. So then there's all that. And then there's also, it could be, it's more physically demanding, the work is, there's the emotional labor that comes with it. So this whole piece is also nuanced per work site and also per sector. Okay, got it. All right. So all to say, now I have another question. So is this psychological health and safety, is it a binary thing? Like, does a work group or a workspace, does it have it or not? Like, is it like that?
No, I mean, you can have it to degrees, and to that extent, it exists on a continuum, really. So it isn't something that is static. It's not something that you're kind of one and done. You don't get to just tick it off a list. It's not something you start and finish. The conditions of the workplace are dynamic, and they're subject to so many different influences, intentional or otherwise, right? So that psychological health and safety can fluctuate. And even to your point around social intelligence and sort of the chicken or the egg, even that we can see, you know, how dynamic that is and how that can really influence kind of the psychological health and safety and to what extent it exists. So it is something that is really, really fluid, which is, you know, really great in as much as there's always an opportunity that an organization can do something to continually improve the psychological health and safety. So, you know, they need to be present to those changing conditions, but they can also take strides to continually support the psychological health and safety of their workplace, and to continue to just kind of shift that needle along the continuum.
Okay, thanks. So let's look at the next polling question.
Mhm.
We asked if any of these were a concern. So I'm kind of curious, does psychological health and safety factor into any of these concerns or challenges?
Yes. So I see these concerns as basically indicators of the psychological health and safety of the workplace, and kind of ultimately reflect the degree to which it is psychologically healthy, you know, and safe or not. So, you know, these indicators arise because the conditions of the workplace are not necessarily considering or meeting those basic psychological needs that we talked about of their employees. So looking back to that conversation, when their psychological needs are not being met or satisfied or considered, it leads to feelings of tension and distress, right? So, and when people are experiencing those tensions and those feelings of being distressed and discomfort, it manifests both directly and indirectly in a variety of ways. And that's essentially what we're seeing here. So you see things like psychological injury, burnout, absenteeism, interpersonal conflict, whether it's bullying or incivility, right? Impaired decision making, and also a desire to change your circumstances, right? As human beings, we want to alleviate those feelings of tension and discomfort. So that's going to motivate us to want to leave our workplace and find conditions that are better designed to meet those needs that we have. So when an organization takes those steps to sort of consider and try and meet the needs of their employees, they're ultimately enhancing the psychological health and safety of that workplace, and by virtue of doing that, we'll likely see a decrease in a number of these conditions that have been identified here.
Okay, so these are kind of like signals.
Yeah.
Yeah. Okay. All right. So last polling question, curious what your comments. So we had, like, just now I'm kind of curious. So we had this one where it was like a 3.7 in terms of clarity, but then there's like, a little less in terms of confidence to actually, you know, do something. So tell us about the pilot program that Safe Care is launching to help folks feel more confident and or do stuff to support or address psychological health and safety in their workplaces.
Yes, so we can appreciate that this can feel pretty overwhelming. And so this year we launched a pilot project where our member organizations have the opportunity to lean on our psychological health and safety expertise, that's me, where we collaborate and we will work together, and I will guide you through a process of conducting a strengths and gap analysis where we can look at what things you are doing that your organization has that's supporting psychological health and safety, In many cases, we are doing things and we maybe don't even recognize or realize that these actually are things that are supporting psychological health and safety. So we want to really recognize and name those and make sure we maintain those and even improve them. And then look at those gaps and those areas of needs that an organization has to improve and enhance the psychological health and safety of the organization. So through that process of conducting that analysis, we'll create a tailored action plan with targeted initiatives that we create that together and then support you to implement that into your workplace. Key point is that the pilot is currently at no cost to any of our member organizations, so it is a free consultative service. Yeah, and I guess if you want to learn more, we are in the process of putting some more information on our website. Apologies, it wasn't ready for this, but stay tuned. It will be announced in all of our wonderful social media posts and newsletters when it's available. And in the meantime, please feel free to email me, reach out. I'm happy just to have like a brief chat to give you more information and kind of talk to you about what that process looks like. So
Excellent. Thank you very much. So it's an important topic. There's lots of indicators that maybe it can be problematic inside or in organizations, and Safe Care is here to help, and it's not going to cost anything. Bonus. So everybody on our webinar today, again, you can hear all this stuff. It's all very intriguing, but if you don't do anything with it, I don't know, not so helpful. So going to give you 30 seconds. Reflect for yourself. What's one idea that you may want to experiment with that kind of came up from Sheila's comments, or maybe you have a question that you want to ask her about psychological health and safety in your work group or in your building, in your work site, or just note down Sheila's email address because you want to be part of the pilot, whichever it is. So I'll give you 30 seconds. Just note it down. And if you have any questions about psychological health and safety just now that are not super in depth, please feel free to pop them into the chat. That would be great. Thank you very much. Okay, let's move on. So here is where we are at, folks. So the conversation, and I have this extra little line, so it's just going to make it more interesting for everybody. There it is. It's keeping everybody awake to see it on the PowerPoint. So the Conversation with Leaders series is about giving leaders actionable strategies to improve your team communication, your respect, your overall workplace well-being. We've been using the lens of social intelligence, and Safe Care has somehow managed to provide resources or get funding for some terrific actionable strategies for members. So we talked about the Civility Matters toolkit, right? It's available on the website. You can do with it as you'd like. You can do it in a small way. You can do it in a big way. It's kind of up to you. You can go into as much or as little depth as you would like. So that's one resource. Another resource is Sheila's pilot program of enhancing psychological health and safety in the workplace. So that's where they will come in and do an assessment. So it's great. From your poll responses, these tools could be really helpful because your work isn't so easy, right? There's all of the challenges that we saw in terms of incivilities showing up, bullying and harassment showing up, all those things. So, 2 resources. I want to check something else though. These are things that aren't as quantifiable as the other things that we have polled on. So here, one more question about challenges. Let me know. So going to menti.com again, entering in this code. So these are I just want to know, are any of these things issues in your workplace, or are you kind of tired of them? Are you tired of staff treating residents great, but each other not so much? Because this is what I hear. Or do you have it where leaders, and you can answer as much, pick any of these that are as relevant as possible, or leaders are spending lots of time on staff to staff issues, and you think, why am I doing this? Staff should be able to take care of this themselves. Why am I getting involved? Or you have it where staff are taking things personally between each other, and it's like, what? It had nothing to do with you, and yet you see this happening. So I have it as a pie chart. It's more because this was the way to have these options show up bigger. So it's not whatever. We're just kind of, you can pick as many of these as are relevant for you. I should have had an option of not relevant at all, but I didn't, so my apologies. So we are seeing that the staff taking things, well, actually, they're all kind of a thing. Anybody else have it? Oh, and I see more blue lines. Who knows? I don't know how these things, it's fascinating how these things show up with technology. So either way, you are not alone if these are happening. So I have one more question. So we have these behaviors. How much do they cost you? How much do they cost you in time or in money? And you can just ballpark it in terms of, and you can do this on a weekly thing, monthly. What do you think? How much is this costing leaders? How much is this costing your staff in terms of money or time, where staff are treating each other worse than they are treating residents? So this is a text field. It can be up to 200 characters. I think you can note down as many answers as you want. Just looking for a ballpark. I mean, I can make up stuff, but so yes, too much is a good answer. So would lovely be helpful to hear more specifics if possible in terms of just time. Is this like 5 minutes a week or 5 minutes a month? Or is it like 10 hours a day? Like, what's your sense of how much, or money? How much is this costing you in money if you want to kind of do the conversion of time to salaries? So about 3 hours a week. Excellent. Anybody else have any ideas of how much it's costing you in time, let's say, of staff treating each other not so well? Energy, yes, 1 hour a day average. So that's like 5 hours a week. Both, unfortunately, it's costing time and it's costing money. Okay, so and if there's more answers that are popping up, that's great. Here's the thing. Clearly, you are not alone if this is happening. So there is a lot, especially when they involve unions. Yes, 2 to 3 meetings, 1 hour each per week. Oh, yes. Okay. So one more really good actionable strategy that SafeCare has been able to get funding to offer members, and I am very excited and I'm going to tell you lots about it. Okay, so here we go. It's called SCORE. So it's an acronym that is evidence-based. So what this program does is it strengthens a culture of respect and engagement. And yes, it is evidence-based, so we know it actually does these things. So it improves all of these things. And how do we know that it does all of these things? Because there's a pre and post survey done in all of the programs. Also, because the program has been heavily researched, there's a predecessor or precursor program called CREW, Civility and Respect and Engagement in the Workplace. It's been done with thousands of work groups, has validated results. It's been around for 20 years, many peer-reviewed academic papers that are written on the results. These are all the things that we know CREW and or SCORE, SCORE improves. SCORE was developed by an expert, a Canadian professor, Michael Leiter, out of the East Coast. He's an expert, written a bunch of books on burnout, also knows lots about civility and stuff. And his papers have included research showing that improvements from the SCORE program are sustained 1 year post-intervention. That was what his study looked at. It was peer-reviewed papers, and that study was done with Canadian maritime hospitals, work groups there. So we know it increases those things and it decreases these kinds of things. And I can attest to this. I can attest to this because SCORE is new to British Columbia. It's new to long-term care. And we did a pilot with a local care home, Finnish Home, for the past year or so. And we saw these results. So the sponsoring leaders at Finnish Home, they couldn't make it today. I have a lovely testimonial video that's 45 minutes. It's too long. I need to edit it. I don't know how to do that, so I don't have the video. But we might have excerpts from the video and a SCORE informational webinar that we are doing next Tuesday, the 25th, I think, at 11 a.m. Next Tuesday, 11 a.m., SCORE informational webinar. In the meantime, here's the results from the Finnish post-program survey, one of the studies, or one of the graphs. So you can see, like, work group civility. Look at this. Higher, green is good. B is before they did it. It was, look at that. That's where civility was at. And green is what it was after. So green is good. Look at how it improved. So we did 2 work groups. It improved for both. SCORE expands a team's capacity to behave in civil and respectful ways with each other, including when they are stressed or when they are in the midst of challenges. So including in all those things that Sheila talked about can be problematic. And how does it work? Well, it strengthens or targets a work group's culture versus trying to improve individuals through education or through treatment. It works with a team. We don't do something to a team. The team, the intact unit, are very much active agents in the process. It raises participants' awareness of the importance of civility and respect on the job, and it increases their awareness of their level of civility or incivility with colleagues. So again, it's increasing their social intelligence. And it also has them accountable for improving their workplace culture. Let me say that again. It has them, the workers, responsible and accountable for improving their workplace culture. And it supports them taking action. It supports them changing their behaviors, changing how they interact with each other on a day-to-day. So the logistics of it, there's facilitated sessions facilitated by an expert, that's me. There's about 55-minute workshops. We have about 8 or 9, we do them monthly, so 8 or 9 depending on your work group. It's all customized to your work group. So we have content, but it's not about teaching people stuff. It's about them doing things. So it all is really customized to your work group, what's needed to support them. Though you need to have a supervisor involved who will support the work group between sessions, like running the weekly 15-minute SCORE huddles. And I instruct and mentor people on how to run the huddles. I have a theory on why SCORE works, and it's actually based on data, and it's based on principles that we know. SCORE gives people the time, the opportunity, and the guidance to connect and to interact respectfully. Like they learn how to do it. So it's different from the toolkit where you can download something and you can kind of do it whenever you want. It's different than Sheila's assessment where somebody's coming in and giving you ideas and you may or may not choose. No, with SCORE, there is a ton of support and lots of structure. So why would you bother doing it? Well, because of the problems that you have. So all the stuff that we saw in today's polls are, the incivility, the bullying and harassment, the turnout, all those things. Or the other pieces, right, of stuff taking up your time and you're thinking, why am I getting involved? Problematic workplace cultures rarely fix themselves. So that's one reason. Another one is because you've tried stuff. You've done one-off workshops. You've sent people to courses. You've had disciplinary conversations. You've had feedback conversations. You've tried the Civility Matters Toolkit. The problems aren't going away. So you and your team are now ready. There's a genuine interest and commitment to something changing. It's enough of a problem, it's enough of a priority that you are willing to invest the time because you're already putting in 3 hours a week. We saw that just now, right? It's going to be a few hours per month, I think about 2 or 3 actually per month for the frontline leader and 2 hours per month for participating staff. And you can have up to 2 work groups per site and up to 12 people per work group. You also need to be willing to invest money. So Safe Care has funding. They got funding for a grant of up to 50% of the $20,000 program fee. But you need to put up that 10K. And you're ready and willing to be vulnerable, right? Because that's kind of a thing that happens. It's just kind of a thing. So you need to be able to talk about what's going on. So we saw this readiness and willingness with Finish, the pilot that we did at Finish. It happened because the OH&S committee asked for respectful communication training for staff. Yes, they thought that everybody else needed the training except them. Like, I get that. And it doesn't matter. Everybody recognized there was a need. So super important. And it's important because participation is voluntary. People have to want to attend. And don't worry, it does trickle over to others because new norms get set. And it's also one site because we work with work teams. So instead of relying on employees' good intentions, SCORE, as a leader, you are explicitly supporting a process that monitors the level of civility in your work groups and supports the team to change, supports the team to respond accordingly when those levels of civility are out of the comfort range. So that piece of paper that you've been noting things down, one more thing. So what's one way that SCORE could benefit you personally, or your organization? And would that save you time? Would that save you money? And if so, how much? So I'll give you 30 seconds. All right. Slightly short of 30 seconds. I'm going to go. So we have 3 terrific and different tools that we've talked about. We have the Civility Matters Toolkit that you can download. You can do with as much as you would like. You can disperse it easily across your organization. So if you have multiple sites, we have Sheila's pilot project, right? You can email her about it. So you're going to have a consultant who will be guiding you in terms of assessing you and also giving you some guidance. You get to choose on what you will do and when you will do it. And in the SCORE program, you have a facilitator who's going to be doing a lot of the heavy lifting, directing you in terms of what needs to be done and supporting you to make the changes, but somebody who's going to be kind of holding the whole process. These two are the Civility Matters Toolkit. This one's free. The assessment is free from Sheila. The stuff that she may suggest may cost you money. It may include suggesting SCORE, just saying. But the initial assessment is free. SCORE is going to cost you money. So there it is. So there is a difference between them in terms of levels of, I don't know, degree of commitment. You get to choose money, what all those things. Here's the bottom line. This is the slide that we use in the SCORE program because it's how change happens. We know that actually doing good stuff is how good things happen. So we have a final poll. Here's, oopsie, sorry. Let me go back. Final poll. Here we go. So of those 3 tools, you get to pick one, maybe 2. Which one are you most interested in for your team? So this is just helpful for us to know. So which one? Which one are you most likely to go ahead with? So we've heard from 2 folks. Let's hear from others because I'm pretty sure that there are more than 2 people. There's 30 people on the call. So let's see. Excellent. Intriguing. Good. Good. So this is, so keep answering, please. Let's see, because we still have time. We have 2 more minutes. So you have a moment yet. So this is really helpful for us to know because this was the Civility Matters Toolkit, right? So it's not going to cost you anything. You are going to get to choose how much you want to go into it. And we know that for Sheila's assessment, this is really helpful. So great. Good. Good. So here we go. We have our final list of resources. I'm going to just be wrapping up unless there's any other questions. So we do have the SCORE informational webinar. So for those of you who are interested, let's see, let's go back, sorry. So of the 5 of you who are interested in SCORE, or there may be other, whichever, you are welcome to attend the webinar. We will be including the link in the follow-up email, and you can probably find it on the website somewhere next Tuesday at 11 in the morning. We also have SafeCare's also hosting the webinar on managing challenging conversations as a leader, which is super helpful for all of the things that we're talking about. And then, of course, there is the Leaders Forum coming up on March 14th. Fantastic. So I just want to check in if there's any other lingering questions that folks have. If not, it's been a delight, a treat to be hosting this year's or the most recent series of Conversation with Leaders. Be well, go use your social intelligence, and together, let's improve workplace culture one conversation at a time. Excellent. All right. Be well, all. Take a breath, and we'll see you all soon.